Now, let's go to health. Not being healthy, it has to be a part of our overall lifestyle. And one of my favorite doctors, Dr. Remilekun Durojaiye, she's here. We're talking about cerebral palsy. That's what we've been talking about the last week, and even for how physiotherapy can help people living with the disorder on, of course, a health segment. She's a physiotherapist for over 33 years, the clinical director for Special Olympics, Fun Fitness Nigeria, and the physiotherapy screening arm of the Healthy Athletes Program. It's great to have you, Doc.
Good morning. How are you?
I'm good. We've been talking about cerebral palsy and physiotherapy and all of that. You know, a lot of times we know cerebral palsy is something that is at birth. A lot of people are born with it. Is it something that intending mothers can avoid? Is it something that maybe it's a lifestyle that causes it? What is the cause?
Right, there really is no cause that has been pinpointed, because all that the research has showed is that it can happen either before, during, or after the baby is born. So there's really no definitive factor that they can say, okay, yes, this is the specific cause of cerebral palsy.
Are there things that maybe the mother can do that will make the baby more susceptible to it? Are there things like that?
Cerebral palsy is one of many neural diseases that can happen, neurodevelopmental issues that can happen with babies, and there are many factors that can affect the integrity of the baby when the baby is born. Things like smoking, drinking. I mean, there are a lot of things that can be part of your healthy, non-healthy lifestyle that may predispose to some of those things. But there's nothing that's really been pinpointed to say, okay, if you don't do this, this will happen.
And then after birth, for someone who's not born with it, how does it come into the situation? How does it come into the equation?
Well, when a baby is born, typically they should develop normally, or typically, as we would say. If your child is not developing typically, then there are things we call red flags. You know, if the baby is not lifting their head by 1 or 2 months, your baby is not rolling in the first 3-4 months, those are the signs to say that, okay, something might be wrong, which is why screening the babies, you know, they go for their well checks to their pediatrician, you know, you'll be able to pick up those things and identify that, okay, or for some parents who've had previous kids, they'll be like, my other kids have, by now, they would have done this. So those are sometimes some of the signs that will indicate that something is wrong.
What's the next step to take when they happen?
Really, physiotherapy is a key factor, because at those early stages, one thing I mentioned where our specialty is movement. So when a baby is born, the early years, 3 years, 5 years, is when, especially 3 years, a lot of your movement, the baby has head control, they start to roll, they start to sit, they start to crawl. So all those things have to be, the baby needs to be taught how to do all those things. So physical therapy is very critical in those early years to get the kids to at least try to move towards those developmental milestones, which is what they're called.
How much of control can they regain? If you were to give a ratio or a percentage, is it possible to regain almost all control?
It's very difficult to say, because cerebral palsy can affect a child in different degrees. There's like a spectrum. You know, they talk about a spectrum with autism. Yes. So there are kids who you might not even know they have cerebral palsy. Sometimes till they start walking and they have problems with their gait. And there's some who are very severely, we call it motorically affected. And some of those kids may never actually sit on their own. They may never walk. But really, you don't know till you start working with a child, and only really time tells how well or not they're going to do. So
we're saying that it's something that is unique to each person, the way they respond to the particular treatment. But if physiotherapy didn't come in early, much later in life, can it help?
It can, but the progress is going to be slower and not as much. And there are some kids who are born with severe disability. So physiotherapy is more of maintaining. We talked about maintaining their best possible function, and that is really within the scope of the child's limitations or disability. So it's difficult to say if they had started physio from 1 month, they'll be able to walk when they're 2 years old. Because there's some kids who, because they're severely affected, may never walk. But that doesn't mean you don't do physiotherapy. Because you still want to put them to stand, because that's what strengthens the bones. You still want their muscles to be moving. You still want them to gain full movement of their limbs, just so that they can be taken care of much easier. So their activities of daily living and the care of them is not as dependent as it would have been.
All right. Now, this is just to confirm. If it's not seen in a child at birth, is this something that can develop or start? Someone can start seeing much later in life, like maybe teenage, adolescent?
Not that long, no. If it's something that would be picked up earlier than that,
okay.
Yes.
So if
Typically,
it's kind of,
by the time they're walking,
okay, it should have been there.
Yes.
Now, apart from the physical, the gait, and the posture, and all of that, what other effects in the body do we see from cerebral palsy?
It can also affect their cognition, their ability to, their intellect, thinking, and sometimes and all those conditions that affects is when school age, when they start 2 years, when they should start playing with puzzles, when they should start doing activities that involve thinking, when those are absent.
So and dyslexia and all the rest, those ones are...
There are tests that can be done to identify some of those deficits.
Should they have a special school? Can they go to school with other kids?
It's called inclusion. We encourage that.
Exactly, that's what I wanted to make.
Yeah.
That inclusion. So we can let them be, you know...
they might need support, depending on the severity.
Okay.
But like with any child, you develop based on the peers around you.
Around you.
So that helps. I'm not saying they'll then become typical like the peers they're with, but definitely raises the bar for them a little.
What can we do? Because we've seen a lot of stigmatization from other kids, and some of these young kids might not really understand what it means to, you know, to be humane and all that. So what can other people do when you have people, when you have someone who's suffering from cerebral palsy around you? What can we teach the kids? What can we teach other people in how to relate with them?
I mean, we need to teach them that we're all not alike, and we need to let people who have disabilities realize they have other abilities, and they're not different. It didn't happen because somebody cursed them. It's just an incident of birth, you know, and it could happen to anyone. So we need to sensitize parents, and it's the parents who sensitize the children.
The children.
Exactly.
And of course, whatever they are, schools, the authorities should also sensitize. That's very, very important.
Yes.
Thank you very much, Doctor. It's
You're
always
welcome.
enlightening talking to you.
You're welcome.
All right, hope we're able to pick something. And like she said, inclusion. Let's learn to be more, you know, accepting. And let them know that, look, there's nothing wrong with you. And yes, you are normal. All right, that's it. That's it on health for this morning. We'll take this time out now. Quite a lot more to come on the show. Stay with us.